Hi, I'm Dr. Mahesh Nair, a cosmetic plastic surgeon and director and founder of Nipantech Aesthetics. And today I'm here to discuss the evergreen issue of hair transplant. Why evergreen? Because it's a very sensitive matter for both men and women alike. It has the potential to grow into an emotionally disturbing experience, which can lead to a negative body image and even depression. Hence, it is important for us to acknowledge this concern of hair loss as legitimate and address the anxiety associated with it. So what are the common causes of this hair loss or hair thinning? The most commonest cause is male pattern baldness or androgenetic alopecia, which comes hereditary. The other reasons for hair loss can be hormonal, they can be infections, or they can be nutritional deficiencies, even malignancy. Even in females, the most common cause of hair loss is female androgenetic alopecia. Hair transplant is a surgical procedure which restores naturally growing hair from donor areas to the recipient area. Donor area is the one which has abundant hair, that's why it's called the donor. And the recipient area is the one which has undergone balding or thinning. This transplanted hair is permanent and it will definitely keep growing like your normal hair. So you'll need to dye it, cut it, you may even shampoo it, do whatever. They're as good as your natural hair. Hair for transplantation can also be taken from beard, chest and other areas of the body. But of course the texture and consistency varies than that which have been taken from your scalp. Coming to the types of hair transplant. So as we all know, I think it's common knowledge by now that hair transplant involves two main types, that is FUT and FUE, or it can be even combined depending upon the case and the requirements. So FUT involves a strip wherein a strip of tissue is harvested from your donor areas and hair is then transplanted, whereas FUE involves extraction of the same follicular units using a machine. For female hair transplant, we prefer FUT because in FUE normally the whole scalp, even the donor area has to be trimmed, and women generally don't like trimming all their hair, so definitely FUT works for them the best. Hair transplant also works for beard, mustache, eyebrows, wherever there are scarred areas or burnt areas. Even there, after a thorough examination, we can comment whether a hair transplant or a full thickness graft with hair follicles can be transplanted to the said area. So what happens after a hair transplant? Normally the hair keep growing, but they are out of cycle. So usually in about 2 or 3 months, there'll be the hair may start falling, but after about 6 months you start growing a dense growth, which by about 8 to 10 months gives you the full result of a successful hair transplant. The procedure by itself is very comfortable because you are interacting with us, watching TV maybe, because it is done under local anesthesia, and it's a proper daycare surgery because by the end of the day you're done with it and you can go home the very same day.
So doctor, is it really comfortable just after the anesthesia effect has been gone completely? Is it painful? Will I have headache and all this stuff?
Yeah, to be very honest, see, it's a procedure done under local anesthesia. So usually by about 24 to 48 hours later, the effect wears off. Following which, we do give you a lot of painkillers to manage that headache and swelling. You may have some kind of head heaviness, but that usually takes about 5 to 6 days to dissipate, and then it is back to normal. We also give you some kind of specific shampoos to rinse your scalp with, so that you can get rid of those scabs and those blood stains that you can see. But more or less, it takes about a week to normalize completely. So if you have more questions like these, feel free to ask in the comment section below, or follow me on Instagram for my regular Insta Live sessions which are held weekly, and I'll answer most of your queries there, or whichever way you choose to communicate. Thank you so much.